So, what do you do if a vital sign comes back abnormal? So, you're taking your vital signs, everything that you've been told, either in report or that you've already seen, has been relatively normal, but this time a vital sign comes back abnormal. So, what do you do? Do you just go document it? Do you act immediately? Do you recheck it? So, it's a bit of a complicated answer because the answer really depends on the patient. But there are a lot of situations where you can't just say, yep, this is the right vital sign. I'm just going to record this. You can't just always accept that first number and move on. So there's a bunch of reasons why you would recheck it before you moved on. So first, you would recheck a vital sign if the result was completely unexpected. Maybe your patient's blood pressure is suddenly much higher or much lower than in their previous reading, or maybe their heart rate was really normal early in the day and now it's very significantly different. So if you look at your patient and they don't look like they're deteriorating, before you assume that they're deteriorating in something you can't see, make sure the measurement was accurate. So was the blood pressure cuff the correct size? That's a big one. Make sure you have the correct size cuff. Again, if this is your first assessment of the patient, make sure that it hasn't been changed at some point. If this is the first time the patient's in the room, double checking that size. If this is your second or third assessment and you've used the same blood pressure cuff, that may not be a consideration, but think about it. Is your patient moving, talking, crying? We know that if their legs are crossed, if their feet aren't flat on the floor, if they're talking or moving during a blood pressure assessment, they are very inaccurate. Sometimes if they're talking with their hands, which I love to do, their O2 sat may not read appropriately. Or if they're talking now and they weren't talking before, maybe their heart rate has changed. And so is the O2 sat probe properly clipped, right? Like, is it turned sideways? Is it disconnected? Is it sitting on the bed somehow, reading something else? So if you correct all of those issues, then redo the patient's vitals, right? Recheck the measurement, see if anything has changed. The next thing you'd look at doing is rechecking a vital sign that does not match at all what you see. So the patient is on the O2 sat monitor. The monitor is telling you the patient sat is 82%, but their respiratory rate is 16. They're talking to you, they're comfortable, they don't look like they're having any work of breathing. When you look at the chest, there's no indrawing, no tracheal tug, no substernal or intercostal retractions. And so patient looks well perfused. Recheck that O2 sat. It could be right, but let's recheck it before we assume it's right. Maybe if the opposite happens, right? So what if, and this is something we see a little bit more frequently, I think, is that like actually the patient's O2 sat looks normal, but the patient looks distressed. So their O2 sat hasn't started to drop yet, but they look like they're in respiratory distress. Recheck that, because that's also incorrect, right? So both can be true. So you're going to reassess if the patient doesn't match the vital sign. So the patient is flushed and feels hot to touch, but you check a temperature and it's telling you the temperature is normal. Recheck the temperature in another site, because maybe it's the thermometer, maybe it's the patient, maybe they just had some ice water and you're checking an oral temp. So, follow up with some of those things. Don't assume that one number is going to overrule all of your other assessments, but do know when you should and should not be taking the time to recheck that vital sign. Also, make sure that you recheck a vital sign after you've done any intervention. Patients having medication for pain or fever. Know the onset of your drugs. Go and reassess the vital sign when that drug should be onsetting, right? Is it helping? What if you administered a fluid bolus? So you should be rechecking a full set of vitals, including blood pressure, at the end of that. If you provide oxygen or reposition your patient, you should be reassessing their O2 sat. You need to know if the intervention worked. That's why you did the intervention. If the intervention is not effective, then you need a new intervention. So, of course, that will all depend. Also, make sure that you're aware of your organization's policies, because your assessment and the timing of your assessment may be determined by policies that are in place. So how often do you need to be rechecking if your patient's had a bolus, or if your patient's on certain medications? Do they need continuous monitoring, intermittent monitoring? So of course, if you're doing interventions, you have to know your institution's policies on what to do when you're doing those interventions. You're doing those repeats to make sure that your patient is either remaining stable, improving, or deteriorating. So you really need to be clear on what you're doing and why you're doing it. But really, don't just repeat a vital sign because you don't like the vital sign and you want something better. Make sure that when you're repeating a vital sign, you're doing it and you know why. You should always be able to tell the why. Why am I doing this again? Am I checking it again because I've done something different? Am I checking it again because it doesn't match the patient? Why am I checking it again? Do not just repeat it for a number that you like better. And if the patient appears unwell, or the result requires really urgent action, assess the patient and get help. Escalate quickly. Don't be like, oh, the patient looks like they're satting 82, the monitor's binging 82, but let me just recheck it. Escalate according to your policies. And then confirm the measurement. Sure, do it again, check another finger, but don't wait to escalate when you can clearly see that it's a problem. Rechecking a vital sign is not just about checking for a new number, right? You're not just looking for a new vital sign. You're answering your own clinical questions. So has the patient's condition actually changed, right? Is it actually different? And is the patient responding to what I did or what I could have done? Because it's not just about recording your vital signs. Yes, we must record our vital signs, but really what we're looking to do is making sure that those vital signs that we're recording actually correspond to the patient that we're caring for.